Okay. Now, would the public out there find their corollary in you in a naturopathic physician, certain chiropractors, MDs and DOs who have an alternative medicine bent? I mean, who are your colleagues in terms of a similar approach to thyroid?
Well, you know, I have my mentors out there for sure who have taught me this stuff, and number one, but you know, a lot of people aren't doing functional medicine the way it should be. That's why I'm actually giving seminars to chiropractors, medical doctors, and naturopathic doctors to get this message out. But there are doctors using complementary alternative medicine out there who use both medicine and regular, like prescription, and also do alternative medicine. And we have to realize that, you know, those are some of the people that I would recommend. There's MDs that I work with. If people need to have a prescription, they would be more than happy to write it. Now, we have to realize that there's more than just Synthroid out there. There's something called Armor Thyroid, which is a natural thyroid medication, and that has both T4 and T3 in it. So you don't have to convert T4 into T3 in the body. And sometimes patients may benefit much better from that than just a T4 medication. So everybody's different. So you have to listen to the patient, you have to see if they're getting better, and then you have to objectively retest them to see if they're improving.
Let's go into a little bit more detail about this idea of functional medicine, which I think is a catchphrase that you utilize to cover an approach to medical problems and an approach to maximizing your health that's more natural.
Well, we have to realize that our body functions as a whole. It is not an isolated set of parts or organs. It functions as a whole. We have our endocrine system, which is a series of glands and organs that communicate and interact with one another. They're interconnected. They're a big communication system. And we have to realize that sometimes these different organs and glands can stimulate, other times they inhibit. And what happens is that a lot of times something gets awry. And let's say for instance, you have high cortisol, you have an adrenal problem, then that can affect your thyroid. Then the thyroid gland gets affected. Then your adrenal glands can get affected, and that can cause depression. So you see there's a multitude of symptoms that overlap, and it's not just one specific organ or gland that is at fault. So what we do in functional medicine is we try to improve function of the whole system. So we test all the systems and not just one particular system.
Right. In the few minutes we have remaining, let's go over some of the ideas from some of the other shows we've done. Let's talk a little bit about why the average American might want to think seriously about taking vitamins, but only, as you say, vitamins that are from whole food sources.
Well, we have to consider that because, number one, we're not getting enough nutrients and vitamins in our foods because our food's been processed and they actually kill all the vitamins off and then they spray some synthetic chemical vitamins back on. And we have to realize that if we want to prevent disease, if we want to stay healthy, that these nutrients, these enzymes, these cofactors are vital for the biochemical steps in our body to occur to allow certain things to occur inside our body. Otherwise, if we don't have that, it leads us down the road to pathology and ultimately to disease.
What do you have to say about milk? Like, how do you feel about low-fat milk, whole milk, that sort of thing?
I'm not an advocate of milk. If you want to look something up, you can go to notmilk.com and read a bunch of information about milk. We have to realize that, you know, if it's organic milk, I'm okay with that to some degree. But we have to realize that regular milk has a lot of hormones in it and has a lot of antibiotics in it. And to me, that's not healthy if we keep putting those things into our body. Of course, they're injecting the cows with hormones to produce more milk so they get more bang for their buck. But in the process, we end up with those hormones in our bodies.
The perspective that the doctor is sharing right now on milk is one that a lot of Americans share. But I would mention that people who are in favor of milk, industry organizations, would say that the research is not definitive at the present time. That's their perspective. And of course, our purpose with these shows is to give you another perspective, a perspective of the part of medicine called alternative medicine, which focuses on maximizing health through natural means. So if you're listening to this and saying, I don't agree with that, that's okay. And it's not something that everybody agrees on in the United States, but you're hearing a different viewpoint, which is what it's all about in America. Now, let's talk about some other things. What's the problem with letting your kid drink pop all day?
Well, the pop is very high in sugar, And we know that pop can really affect and screw up young kids. As far as sugars can create vitamin deficiencies, it can affect physical behavior, attitude. And so by giving these kids pop, it just becomes a habit of them. And you know, what happens is that it's going to end up causing insulin resistance, and then they're going to end up being obese. I mean, just look around and look at our kids. And you know, we used to get pops in little containers. Now a large is like 2 quarts. And it's way too much, and our system can't utilize it properly, and if we don't utilize that sugar, it turns into fat.
I will mention that in those countries, some in Asia, where the diets are changing and they're going from an Oriental diet to an American diet, their statistics on disease are starting to look more and more like America's. And so
Exactly.
there appears to be somewhat of a link, and that, again, we're certainly not going to say that any particular food, I would imagine that you would say that pop in moderation.
Yeah.
If you're eating fruit juices and water and you're kind of eating a balanced diet, it would be okay. What you're against is an all processed foods diet with a bunch of pop.
Well, and we also have to watch the fruit juices because they're high in sugars too. So
That's
we
an
have to
issue
read
there.
the labels, and you have to look, see how many grams of sugar in there. But realistically, you know, we were just brought up in the food industry, said let's get the pop on the table when they come to a restaurant, and let's see how much pop we can sell. And realistically, I think if they minimize it, not in moderation, 8 ounces of pop for a young child today is more than enough, and maybe twice a week.
Why should every American consider moving towards a more natural, careful selection of foods?
Well, for their own health, and if they want to live longer, if you want to be happier, if you don't want to be laying around in bed for the last 10 years of your life, you want to be active, you need to look at your health and your diet, because ultimately you are what you eat. And if you want to put bad things in, it's going to end up resulting usually in a disease process.
Very good. Well, again, this is the 4th show in a series of 6 that we're doing on alternative medicine. You're hearing a different story today, very different from what we hear from hospitals, DOs. And it's great to hear these different perspectives. So thank you so much, Dr. Unger, for being with us on Medical Matters.
It's a pleasure being here.
Great. We'll see you with the remaining shows in our series on alternative medicine per your request. Have a good day.